Tay-Sachs disease by Jenna Swanson and Aaron Gilfillan.
Genotype for Tay-Sachs. Tay-Sachs is a gene disorder, therefore the chromosome number is normal. A recessive mutation of the hexagene on chromosome 15 does not allow lysosomes to function properly. An affected individual has 2 copies of the recessive mutation.
Phenotype for Tay-Sachs. 3 to 6 months of age, you may notice that the child makes less eye contact and has a hard time focusing his or her eyes on things. A doctor may see a red spot on the child's retina. 6 to 10 months of age, you may notice that the child is not as alert and playful as he or she had been. It might be hard for the child to sit up or roll over. You also may notice that the child does not see or hear well. 10 months and older, the disease gets worse quickly. The child may have seizures, have an intellectual disability, lose his or her vision, and not be able to move.
How often does this disease occur? It is very rare and less than 20,000 U.S. cases per year.
What causes Tay-Sachs? A defective gene on chromosome 15 called hexa. This defective gene causes the body to not make a protein called hexosaminidase A. Without this protein, chemicals called gangliosides build up in the nerve cells in the brain, destroying brain cells.
Treatments for Tay-Sachs. There is currently no cure for Tay-Sachs disease. The aim of treatment is to make living with it as comfortable as possible. Specialists will come up with treatments like medications for seizures and stiffness, speech and language therapy for feeding and swallowing problems. Sometimes special bottles or a feeding tube may be needed. Physiotherapy to help with stiffness and improve coughing to reduce the risk of pneumonia.
Some symptoms of Tay-Sachs disease would be decreased eye contact or blindness, decreased muscle tone or loss of muscle strength, delayed mental and social skills, dementia, increased startle reaction, irritability, listlessness, and deafness.
General information. Tay-Sachs disease is an autosomal recessive genetic disorder, meaning that when both parents are carriers, there's a 25% risk of giving birth to an affected child with each pregnancy. The affected child would have received a mutated copy of the gene from each parent.
Some more general information. Infants and young children would both contain red spots on the retina of their eye if they had the disease. Some people describe the dots as little cherries.